Sars Cov2. What is coronavirus? Coronaviruses are a large group of viruses that cause diseases in animals and humans. They often circulate among camels, cats, and bats, and can sometimes evolve and infect people. In animals, coronaviruses can cause diarrhea in cows and pigs, and upper respiratory disease in chickens. In humans, the viruses can cause mild respiratory infections, like the common cold, but can lead to serious illnesses, like pneumonia. Coronaviruses are named for the crown-like spikes on their surface. Human coronaviruses were first identified in the mid-1960s. They are closely monitored by public health officials. What is Sars Cov2? Mode of transmission, diagnosis, symptoms and treatment. Symptoms, precautions, treatment. Graphs. Flattened the curve, fertility rate by age. What is Sars Cov2? Coronavirus disease 2019. COVID-19 is an infectious disease caused by severe acute respiratory syndrome. Coronavirus 2 SARS-CoV-2. The disease was first identified in 2019 in Wuhan, the capital of Hubei, China, and has since spread globally, resulting in the 2019-20 coronavirus pandemic. Mode of transmission. The virus is typically spread from one person to another via respiratory droplets produced during coughing. It may also be spread from touching contaminated surfaces and then touching one's face. The virus may live on surfaces up to 4 to 72 hours. Time from exposure to onset of symptoms is generally between 2 and 14 days, with an average of 5 days. Diagnosis. The standard method of diagnosis is by reverse transcription polymerase chain reaction RT-PCR from a nasopharyngeal swab. The infection can also be diagnosed from a combination of symptoms, risk factors, and a chest CT scan showing features of pneumonia. Symptoms. Although those infected with the virus may be asymptomatic, many develop flu-like symptoms including fever, cough, and shortness of breath. Emergency symptoms include difficulty breathing, persistent chest pain or pressure, confusion, difficulty waking, and bluish face or lips. Immediate medical attention is advised if these symptoms are present. Less commonly, upper respiratory symptoms, such as sneezing, runny nose, or sore throat may be seen. Symptoms such as nausea, vomiting, and diarrhea have been observed in varying percentages among people in several studies, with percentages varying from 3% to 31% of cases depending on the study. Some initial cases in China presented only chest tightness and palpitations. In some, the disease may progress to pneumonia, multi-organ failure, and death. As is common with infections, there is a delay from when a person is infected with the virus to when they develop symptoms, known as the incubation period. The incubation period for COVID-19 is typically 5 to 6 days but may range from 2 to 14 days. Fever 87.9, dry cough 67.7, fatigue 38.1, sputum production 33.4, loss of smell 30 to 66, shortness of breath 18.6, muscle or joint pain 14.8, sore throat 13.9, headache 13.6, chills 11.4, nausea or vomiting 5.0, nasal congestion 4.8, diarrhea 3.7 to 31-33, ptosis 0.9, conjunctival congestion 0.8. Precautions. Preventive measures to reduce the chances of infection include staying at home, avoiding crowded places, washing hands with soap and warm water often and for at least 20 seconds, practicing good respiratory hygiene, Avoiding touching the eyes, nose, or mouth with unwashed hands. The CDC recommends covering the mouth and nose with a tissue when coughing or sneezing, or using inside of the elbow if no tissue is available. They also recommend proper hand hygiene after any cough or sneeze. Social distancing strategies aim to reduce contact of infected persons with large groups by closing schools and workplaces, restricting travel, and canceling mass gatherings. Social distancing also includes that people stay at least 6 feet apart, about 1.80 meters. Possible medication. Sars Cov2 has no medication, but the medication are under clinical trials now. The medicine which have shown effective result against coronavirus are hydroxychloroquine and remdesivir. Chloroquine also is effective for mild symptoms. From 24th March, hydroxychloroquine is started as treatment in New York. Coronagraph now. Sars Cov2 fertility rate by age. Thank you.